Hi, my name is Megan. I intern at Vasta Brothers Medical Center. I'm in South Circle 5, which is also the oncology floor. My supervisor's name is Jessica Shaw. We primarily do discharge planning and case management. With that, we deal a lot with cancer patients, and we oftentimes get a lot of overflow from other floors in the hospital. So we never see the same thing, really. It always has different aspects, which is a good thing because you're exposed to a lot of things in this setting. It is very fast-paced, and sometimes that can be a challenge just because you have a billion things up in the air at once and you never really know what is a priority until 10 minutes before it may be a priority. So that can also be a little bit of a challenge. And because you're only in the field placement Mondays and Wednesdays, except for block placement, it can be kind of challenging because you come in on cases that you haven't necessarily started, and you have to pick up the pieces of where other people left off. However, with that gives you a great opportunity to learn and grow as a professional person. And it gives you the opportunity to really learn how to work cohesively in an interdisciplinary environment in order to further a patient's life and to contribute to something that is meaningful in their life and in what you do. It's also extremely challenging to learn all the medical lingo at first, but don't let that throw you. You pick it up pretty quick. It's like a second language. It can definitely be challenging though. And then another thing that can also be a challenge is the policies and regulations. There's just so many that you have to follow and abide by, and it can seem very overwhelming at times. But once you get a handle on it, everything goes a lot smoother, as well as you have a better sense of what you're doing and your role in that type of environment. You constantly learn. You learn a lot almost every day. I come home and I feel like I've done something completely different and new. It does get slightly repetitive with intakes. However, I mean, that's any work environment and anything you do in life. But it really pushes you outside your comfort zone because you're not going to see the exact same thing over and over again. For example, you might have someone who needs feeding tubes and feeding lines, or you might have someone who needs oxygen, or you might already have someone that has oxygen but needs a different type of oxygen, like a concentrator versus, a portable tank. And with those, it comes different regulations, different policies, and different things you have to abide by, and everyone is still learning because there's a lot of different rules and regulations. So it's a great environment to keep learning and to keep pushing yourself to grow. The growth can be very hard at times. I know this year I've questioned what I'm doing in the field a lot, why I'm in the field, and what I want to get out of the field, and that can be very challenging for some people. For me, I really took it as an opportunity to grow as a person and as a professional self, and I've been very fortunate enough to use my supervisor as a reference point to do so and to come back and ask her questions. And I think it's always really important to remember that no one is perfect and you're going to mess up at times, and it's okay to ask a billion questions because we are learning, and I think it's a great learning opportunity to be in a hospital, especially if that's where you think you want to end up. Just be prepared for everything and anything, and I think that it's a great place. And the supervisor style of my supervisor is very hands-on. She's always there, someone to reference, which is great, especially because there are so many different rules, regulations, and policies. And it's always nice to have someone that you can just kind of vent to if you're confused in a situation or you don't really know how to handle it or you're uncomfortable. I think that's the other thing. The hospital really made me appreciate being uncomfortable, and it really pushed me outside of what I would ever expect of myself. And I think that if that's what you're looking for, then the hospital is a great place for you. It really encourages that self-growth as well as professional growth, and it gives you so many learning opportunities, and it's never a dull day. Some days are definitely harder than others, but it definitely pays off in the end, and I definitely feel like I've grown a lot as a person, and as I said earlier, professionally, and I think that the supervisor style is great. Above my supervisor is the other case manager supervisor, also known as Edna. She's like the overarching director, I believe, of case managers, and you'll interact with her a few times, and she's just a fun person, and all the case managers are really fun and easy to work with. In the hospital setting, you do get to work in an interdisciplinary setting, which is very good for collaboration, and I think it's a very exciting environment because of that. So if you want to move around to different floors, it's possible, as well as if you want to talk to someone in physical therapy and see what they're doing, or if you want to talk to a hospitalist or a physician, you have all these opportunities to do so. So if that's what you're looking for, definitely check out the hospital. It's a lot of work, but it's also a lot of fun, and I think it really is a great place to push people to grow and to learn.